ladies and gentlemen, I will introduce myself. I'm Amalia Fadilah Fitriani from Class 2A in Nursing Study Program at Politeknik Kesehatan Tasikmalaya. My country origin is from Majalengka. I would like to thank Ms. Wildan, who has given me the opportunity to show a presentation today, and to the audience who attend. Today, I'd like to talk about mental disorder. Here, I will present a journal article about Balinese people who use traditional Balian medicine to cure mental disorder. There will be several sections that will be presented, including research introduction, research design and methodology, and present the finding, conclusion, and recommendation about the problem. The first section is research introduction. A. Title of the study: Balinese traditional treatment Balian in patients with mental disorder. Balinese people make traditional medicine the main choice in dealing with mental disorder. B. Statement of the problem. Cases of mental disorders are increasing from year to year in various countries. Indonesia is no exception. Mental disorders are something that many people experience today due to excessive mental pressure from themselves and their environment. Various things are done dealing with mental disorder. One of them with traditional medicine. This is still being done because the community still hold tightly to the local culture, which believe that traditional medicine can cure mental disorder. In Bali, people believe that mental disorders are caused by curses carried out by their ancestors and choose traditional medicine by traditional healers or Balian as the main treatment for mental patients. C. Objective. Mental disorders are syndrome or behavioral patterns that are clinically associated with suffering or distress and can cause interference with one or more of the functions of human life. People still believe wrong myths about mental disorder, which are caused by demons, spirit or jinn who are supposed, while some others believe that mental disorder are caused by sin of the sufferer himself or the sin of his family. The role of Balian in treating mental patients in Bali is still very large and is still trusted by people in Bali. Balinese people tend to seek Balian in early treatment. About 76% of them will continue their treatment to a psychiatric, but after being treated by a psychiatric, 80% will return to a Balian for further treatment. D. Scope and limitation. This study focused on exploring more deeply about the use of Balian in treating patients with mental disorder. This journal article will investigate the still very large of culture in the life of Balinese people. This research was conducted around 2018 by the author assisted by his team. In their research, they used a qualitative method with an interpretative phenomenological approach used in-depth interview technique with semi-structured interview guide was for a data collection. Data were analyzed using an interpretative phenomenological analysis or EPA approach. In their research, they conducted interview with 9 respondents who had met the specific criteria, including the respondent had family member who had mental disorder, had used traditional Balinese medicine for at least 3 months, and of course agreed to be interviewed. 9 respondents, they had elementary school, high school, and some did not attend school. The age range from 36 to 45 years, with most of them are married, and all respondents are Hindu. All respondents also claim to have used traditional medicine for more than 1 year and also use more than 3 traditional healers. Researchers, they use method that technique because they considered the most effective way of collecting data. The psychological approach is very suitable for knowing the view of the community and in accordance with the theme taken, namely about mental disorder related to human psychology. The next section is research design and methodology. A. Sources of data. The data was collected through in-depth interview with respondents. Several stages were carried out in the interview, including building a trusting relationship with the respondent to provide a sense of comfort in communicating. Then explaining the intent and purpose as well as the benefit and how the interview process will be carried out, and asking the respondent willingness to conduct an interview was then signed by the respondent and informed consent. Set an interview schedule. The interview used open-ended questions and observed nonverbal and emotional responses given by respondents. Researchers use notebook and voice recorder to document interview. B. Research instrumentation. This study used qualitative method through in-depth and structured interview technique used to collect data, which is analyzed using an interpretative phenomenological analysis (IPA) approach. C. Gathering produce. Several stages were carried out in interview as a media for data collection, including building a trusting relationship with a respondent to provide a sense of comfort in communicating, then explaining the purpose and objective and benefit, and how the interview process will be carried out, and asking for the respondent willingness to conduct an interview, which was followed by signing the informed consent by the respondent and determine the interview schedule. The interview used open-ended questions and observed nonverbal and emotional responses given by the respondent. Researchers use notebook and voice recorders to document interview. The next part is present the finding, conclusion, and recommendation about this problem. First, problem. Balinese people believe that mental disorders are caused by ancestral curses. The use of traditional medicine to treat mental disorder. Finding. Balinese people believe that mental disorders are caused by ancestral curses. This happens because the person who has been chosen to the task ordered by the ancestor does not do the task which is the cursed and causes mental disorder. The evil spirit that is in the sufferer is the main factor in mental disorder. There is a significant behavioral change in the sufferer when the evil spirit has entered the body. The Balian is considered to have a very big role in dealing with mental disorder and is believed to have an ability to cure them. The Balian is also the first and foremost choice in treating mental disorder compared to medical treatment. Through a Balian and medical treatment are carried out simultaneously and are considered to have become commonplace by Balinese people. This is because medical treatment makes patients calm while traditional medicine has become a common belief of the local community. Conclusion: the result of this study indicate that Balinese people still use traditional medicine to treat mental disorder. The Balian is the main choice of the Balinese in the treatment of mental disorder, which are considered to be curative, but they also still use medical method to treat mental disorder, and these two ways are carried out. The result of this study served as the basis for providing mental care with a cultural approach. Recommendation: controlling the Balinese people continue to carry out medical treatment in addition to traditional medicine Balian, so that medical treatment can be carried out intensively and not to leave the community's habit with traditional medicine, because traditional medicine activities have become a culture in society and cannot be abolished. Reference from this journal article can be seen at the PowerPoint. There are about 21 references used by the author to conduct research in this journal article. This journal article shows the very large role of culture in people's life in various fields, especially in the field of health and care for mental disorder. Along the times, there need to be balance between science and culture. Use both without having to eliminate of them, because these two aspects have their respective role. Thank you to Ms. Wildan, who has given me the opportunity to show a presentation about this journal article, and to the audience who have listened and follow my section of presentation well this time. That's all my presentation. I'm sorry if there are still many shortcomings. Thank you for your attention. Good morning and see you next time.